Excellent. So I might get started. So thank you for joining me today. We're going to be talking about treating acne. So my name is Julie Leverington and I'm one of the business development managers here in Queensland, and I'll be taking you through today's webinar. So acne really is a complex skin condition to treat, and many factors must be taken into consideration. However, in today's webinar, I will be covering what is acne, your grades of acne, your types of acne lesions, and we're going to be talking through the treatment of acne through home care, internals, modalities, as well as makeup. So acne is an inflammatory skin disorder that occurs when dead skin cells and oil from our skin clogs in the hair follicles. Typical features of this would be comedones, pimples, and possible scarring as well. So it primarily affects skin with relatively high numbers of oil glands, including the face, the upper part of the chest, as well as the back. Acne has two categories and 4 grades. So we've got acne simplex and acne vulgaris. And we've got grades 1 through to grades 4 as well. So we're going to be discussing these in the webinar today as well. So before we look at the grades of acne, let's discuss some acne facts. So in 2015, acne affected approximately 633 people globally, making it the 8th most common disorder worldwide. Acne commonly occurs in adolescence and affects approximately 80 to 90% of teenagers in the Western world. Children and adults may also be affected before and after puberty, but although acne is less common in adulthood, it does persist in nearly half of affected people in their 20s and 30s, and then a smaller group continues to have difficulties with acne in their 40s. So let's take a look at the 4 grades of acne now and how we can actually treat all 4 grades of acne with our cosmeceutical skincare, which is Image. So when assessing your client's skin, you really do need to determine the grade of acne that you're treating. And that's going to be based on what you see the most of. So do you see mainly closed comedones? Do you see mainly open comedones, pustules, papules, or cysts? So we want to see what we see most of, and that will give you a really great idea as to what grade of acne that you're looking at treating within your client. So let's look at acne classification. So here is grade 1. They will present mostly open comedones, some closed comedones, papule or pustules. This is fairly manageable to treat. So we're going to look at things like exfoliation, extractions, you can do microdermabrasion, and you can even do skin needling on grade 1 acne as well, which we'll discuss later on. Here we have your grade 2 acne. So this has a larger number of closed and open comedones with the occasional pustule and papule on the skin as well. It will be quite rough to the touch if you are doing a skin analysis on your client as well. And it's very similar to treat as it is to grade 1. However, we should probably involve more peels rather than micros and introducing your decongesting ingredients as well. Grade 3 acne, inflammation will start to be present here. So you'll have a large number of open and closed comedones, and you will have many pustules and papules as well. So when we get into our grade 3 acne, what we want to do is use less mechanical exfoliation and look at more of our acid exfoliation. And the reason for that is we do not want to break open those pustules and have that cross-contamination on the skin as well. So we want to be really, really careful as we move into the treatment of grade 3 acne. Grade 4 acne will be a lot, or a little bit, I guess, harder to treat, but it is possible with a full 360-degree treatment plan. So you can use topical applications of products at home, and we've got our in-clinic treatments of our facials and our peels, and the use of modalities like your LED and internal supplements will be so important when we're looking at treating that grade 4 acne. So the characteristics, inflammation will definitely be present here. And when we're treating anything in the skin, if there is inflammation, you must treat that inflammation first before you can treat anything else you see in the skin. So we will be talking about ingredients and modalities that we can treat inflammation later on as well. So you will also have deep cysts. There may be scar formation in a grade 4 acne as well, with many comedones, pustules, and papules as well. So let's take a look at each type of these acne lesions. So first of all, we have got our comedone, or a basic acne lesion, which is a hair follicle that has become clogged with oil and dead skin cells. Comedones, which is the plural of comedone, can develop into bumps called whiteheads and blackheads. So we're going to look at both of those today. Products that may trigger the comedones on the skin are called comedogenic. So we want to make sure that we're using non-comedogenic products on our skin. So we're going to be talking through what is that and why we really want to make sure makeup is an important part of your consultation as well, and why that's so important. So we've got our open comedones, aka our blackheads. So blackheads are comedones that are open at the surface of the skin. They are filled with the excess oil and dead skin cells. So it's actually not dirt that causes a comedone to turn black. The black hue results from the irregular reflection of light coming from that clogged hair follicle. And blackheads can be frequently treated with over-the-counter medications. We can treat it with a number of different modalities, peels, and extractions as well. We've got our closed comedones, so aka whiteheads, and they are comedones that stay closed at the surface of the skin. So this actually happens when the oil in the skin prevents when oil and skin cells prevent a clogged hair follicle from actually opening. So that is your whiteheads. Next, we have your papules. So papules are comedones that become inflamed. They form small red or pink bumps on the skin. This type of pimple may be sensitive to the touch for your clients, and picking or squeezing may lead to inflammation or scarring. So it's really important that we explain to our clients the importance of not touching their face, not picking, squeezing, or anything like that with either the papules or their pustules, because they can cause more damage in the skin, especially deep down into that dermis as well. A very large number of your papules may indicate moderate to severe acne. We have your pustules. So pustules are another kind of inflamed pimple. They resemble a whitehead, but with a red ring around the bump. And that type of pimple will typically be filled with white or yellow pus. So picking or squeezing again can make the inflammation worse and may lead to scarring. And picking can also cause your post-inflammatory hyperpigmentation. So we want to try and avoid that at all costs. So again, making sure if they are ones that want to touch the face, the importance of not doing that, because it can cause more damage in the long term. You've got your nodular cysts. So these can form if papules and pustules are left untreated on the skin. It can be extremely sore and sensitive to touch. And acne cysts develop when the contents of the blackheads overspill into other areas of the skin. And in an effort to fix that situation on the skin as well, the body perceives an attack, and that responds by producing that pus in the skin. It can often leave scars, and it can often be seen as red or deep purple in the skin as well. So there are your different type of acne lesions that you will be looking out for and assessing when you're working out, is my client got grade 1 acne, grade 2, grade 3, or grade 4. So you want to look at the amount of each of these acne lesions that you see on the skin, so we can determine the course of action we want to take with our home care as well as our in-clinic treatments. So let's talk more about scarring that can happen. So acne scars are caused by inflammation in the dermis, and they are estimated to affect 95% of people with acne vulgaris. So abnormal healing and dermal inflammation actually creates the scar, and the scarring is most likely to take place with your severe acne, but actually can happen with any form of acne. So acne scars are classified on whether the abnormal healing response from dermal inflammation leads to excess collagen deposition or loss at the site of the actual acne lesion. So atrophic scars hopefully I'm saying that right, have lost collagen from the healing response, and they're actually the most common type of acne scar that you will come across. So they affect probably 75%, or they make up 75% of all acne scars. You have 3 subcategories of your scars as well. So you have ice pick scars, boxcar scars, which is really hard to say, and rolling scars. So as I say, they're all subtypes of those atrophic scars. So your boxcar scars are usually round indented scars with sharp borders, and they will vary in size, where your ice pick scars are quite narrow and they're deep as well, so they actually extend right down to the dermis. Where your rolling scars are generally broader than both your ice pick and boxcar scars, and have a wave-like pattern of depth within the skin. So what we'll do is we'll actually take a look later in this presentation at the modalities that we can actually use to treat acne scarring. So there will be a lot of modalities we can use. There will obviously be ingredient content we can bring into that as well. So what causes acne? What are the many things that can cause acne on the skin? As I said at the start, it is a really complex skin condition to treat, but we want to have a look at maybe the determination or the cause of acne. So genetics is the primary cause of acne, so in about 80% of cases. But acne can also be caused by heat, humidity, sun exposure, and also breezy workplaces. Other contributing factors may include poor nutrition and diet, which I'm going to discuss later on. So I'm going to be talking about the foods we should be looking at eliminating or avoiding completely, depending on that type of acne that you are treating. So we'll talk about that in a little bit. Clogged pores. So clogged pores from comedogenic products like makeup, skincare, and hair care. I actually always used to explain to my clients, the last thing I want you to do in the shower or once you get out the shower is cleanse your face. That's to actually ensure you've got no residue of that shampoo and conditioner sitting on the skin. So a lot of shampoos and conditioners will, I think Carolina mentioned this in her webinar yesterday, they can have a lot of sulfates and things like that in there. They can have a lot of fillers. And if you think about that line around your hairline and you leave conditioner on there and don't cleanse it or wash it properly off, that can cause blockages in the skin as well and create issues along that forehead. Hormonal activity, such as menstrual cycles and puberty, may contribute to the formation of acne as well. So during puberty, you get an increase of the sex hormone, which is androgen, and that causes the skin follicle glands to grow larger and make more oily sebum. That oily sebum can actually be quite thick and sticky as well. So there are medical conditions that commonly cause high androgen states as well. So your polycystic ovary syndrome, any androgen secreting tumors can also cause acne in affected individuals, and pregnancy. That will also fluctuate those levels and consequently can produce more oily sebum. Acne can also be a side effect of testosterone replacement therapy, anabolic steroids, and over-the-counter bodybuilding and dietary supplements. So it's really important to note that hormone imbalances should be treated before we can truly get an effective result on anyone's acne. So it's really important if they have a hormone imbalance that we look at addressing that first with their doctor or practitioner. And lastly, on this slide, we've got stress. So we're all in a pretty, or have been in high stress levels lately, and that can actually cause acne or make acne worse. So I tried to do a little bit of research on this. There is no definite studies, but, and I think Janine said this herself on Tuesday's webinar, there's no direct link. Is it the stress that causes acne, or is it more the stress of having those breakouts that cause more acne as well? So there's no real studies on that, but we know stress can affect it. So let's take a look at how we might treat acne. So let's firstly look at using a cosmeceutical skincare line. So for today, we're obviously going to talk about MH. So when looking at treating acne with our clients, we need to look at a number of factors. Okay, so we need to look at reducing any inflammation on the skin. As I said earlier, if there's any inflammation present on the skin, we must treat that first before we treat anything else that we see on the skin. We want to have follicle exfoliation and increase our cellular turnover. We want to control the bacteria, and we want to help to reduce that lesion count. We want to oxygenate the follicle, so we all know that P. acne bacteria cannot continue to thrive in an oxygenated environment. And our oligopeptide 10, which I'll talk about in a moment, targets that P. acne bacteria. We want to have oil control, but without dehydrating that skin. That's super important to ensure that when we're treating an oily skin, that we're not dehydrating it at the same time. And that we use non-comedogenic skincare and makeup. Okay, so I'm going to talk about that right at the end of today's webinar. And a balanced nutritional support is so important as well. So I'm going to touch on bestow and internals today too, because I think it's truly important to look at a full 360-degree approach when we're treating clients with acne. So who are our clear cell clients? They are oily clients, they are breakout prone clients, and they can be anyone from your teens, adults, or hormonal acne to treat. So we've got hero ingredients inside Clear Cell. Our hero ingredients are salicylic and glycolic acid. So salicylic acid is a BHA, and that means it's oil loving. It's going to slow down the sebaceous activity and unclog the pores while actually improving the skin's barrier function. Whereas your glycolic acid, which is an AHA, is more water loving, and this is going to help support exfoliation and that cellular turnover. So we can see here that's helping with that sebaceous activity, unclogging pores, and supporting the cellular turnover. So ticking off on those things we need to do to treat acne. Next, we have our benzoyl peroxide, and that will help to kill your P. acne bacteria and reduce the lesion count. This can be quite drying on the skin. So if you're treating a milder case of acne, so say grades 1 or 2, you want to use this as a spot treatment rather than an all-over treatment on the face. We don't want to dry out the healthy skin that's still present there. And finally, we have Gran-Active Acne. That is a blend of your oligopeptide 10 and your honey boswellia extract. Hope I've said that right. So Gran-Active Acne will actually support the reduction of blemishes. It will soothe skin and be a great partner to salicylic acid. So I'm not sure if you don't have MH skincare in your salon, you may not know this, but it's actually better to be paired with salicylic acid. It's more effective, yet less, more gentle, less irritating than when salicylic is actually combined with that benzoyl peroxide. So they're great partners with each other and work really well on the skin while not creating any kind of irritation. So here we've got our regimes for acne. So you can see here it's not all Clear Cell. So what you want to do with Clear Cell is actually pair it with other collections to fully customize a client's regime at home, depending on the grade of acne you're treating and possibly the secondary concern that you also want to focus on. So you can see here we have the presence of our Ageless, we've got some Max in here, our Vital C, our Luma, and our Medic in these home care rituals. So the reason for this is having a client purely on just Clear Cell will not provide the full prevention and nutrition that the skin will need for a healthy diet. So it's really important that we don't just hand everything over from our blue range and image and go, here you go. It really won't support the nutrition of the skin. We want to make sure that we're looking after the health as well as addressing all those other concerns that we see with our Clear Cell products. So Ageless in here is our collection of ingredients like our AHAs and our retinols. So that's going to make it fantastic, increasing our cellular turnover. Where your Max has your plant stem cells, it's got peptides, it's got botanicals in there. So that will aid in reducing any inflammation that we see on the skin, and it's going to provide the skin with nutritional support. Luma has your plant cell extraction as well, but it's got your lightning peptides and your photo-lightning ingredients in here. And what that will do, that will not only assist in reducing the inflammation in the skin, but it will also assist with that post-inflammatory hyperpigmentation that we may see with acne's grade 3 and 4. So it's important to assess that and see whether we need to add that into a client's skincare routine. Our medic has amazing balancing and soothing ingredients of organic green tea, organic aloe vera, and our peptides. So perfect for balancing and soothing teen skins, pregnant mamas, anyone like that. And it really is a teen range that we look at, and maybe just grabbing 1 or 2 little products from our clear cell to assist that as well. So the back of your image manual, if you are an image stockist, there is actually a full comprehensive guide to treating acne grade 1 and 2, acne grade 3 and 4, acne prone, sensitive, and redness prone skins as well. So you can go to the back of your book and really have a look at the different options there for you, depending on that client's concern and their severity of their acne. So now we have our add-ons for our clients. So remembering we should always be reassessing how our client's home care skin journey is going. We shouldn't just be doing one consultation and then 12 months later sit down and have another chat. It should be every visit. How is your skincare going? How's your skin been responding? If you start someone on a new routine, it should be a call a couple of days later, checking in with them, making sure they understand how to use the products, where to put them in. So always reassess the journey and see if there's anything that we can be adding in. So you can see here with advanced acne, we're stepping up to using our Retin-A cream from our Ageless. For our post-inflammatory hyperpigmentation, we put in our Hero Illuminating Brightening Serum. And then for our dry and dehydrated skin, we've got the Medic Serum. That has a 1% lactic acid, so will assist in the hydration of the skin, as well as being that little bit decongesting. Once we have prepped the skin, it's now time to look at putting the client's treatment plan into place. This can be a variety of our peels. It can be from our signature and our medic, which is our enzymatic peels, right through to our advanced self-neutralizing peels for advanced acne and scarring. So each client journey with acne will be slightly different. It will depend on the number of products they can use at home, their Fitzpatrick type. So the higher the Fitzpatrick, the longer the prep time, their comfort level, how often they can visit the clinic as well. So it's really important you know all of that information so you can truly manage a client's expectation when treating any skin concern. Eye enhancers can also be added to further customize the treatment series for each client as well. So we've got a fair few there to choose from depending on what you are treating in any secondary concern. So here's some amazing before and afters as well. So we've got one here for our acne and another one here. So in this picture here, you can see the redness is diffused, the inflammation isn't anywhere near as bad as what it was, and the clarity of the skin is dramatically improved as well. So next I want to discuss the importance of balanced nutritional support and use of internals. I'm not sure how many of you caught Janine's webinar on Tuesday. So Janine Tate is the founder of Bestow Beauty, but she was absolutely amazing to listen to and gain her knowledge as a dermonutritionist and skin health expert. So the number one product that you want to choose from Bestow and introduce to an acne client, well actually any client with any skin concern, is your Beauty Plus oil. Starting your clients on the Plus oil will clear any existing blockages. It will address any essential fatty acid deficiencies effectively. And then after 1 or 2 bottles, you can move them on to the original Bestow oil. However, Denise did mention the other day, though, that she actually stays on this all the time now. So what the Plus oil will do will skirt around any blockages in the skin, provide both primary and secondary fats of both your omega-3 and your omega-6 families. So what does that mean in terms of results? It will moisturize the skin from within. It will improve the barrier function of the skin. It will help form a healing, anti-inflammatory and protective outer layer of the skin. And it's going to help prevent skin congestion and breakouts as long as your clients look at reducing the intake of congesting foods. So let's take a look at the advice that we can give each type of acne client when they come to visit us, and what the Bestow recommendations are. So you can see here for congestion, we're going to be recommending to eliminate congesting foods from their diet. Some of you, this will not be good news. Cheese, chocolate, meat fat, cream, ice cream, chips, unfortunately. There are some healthy alternatives. You can go oven baked chips, you could go sweet potato chips, or kale chips if you want to be, a little bit more out there and try something a little bit different. Things like fried foods you want to avoid, peanuts, cashews, and your nut butters as well. So for this type of client, definitely Bestow oil, ideally the plus oil if you can. We've got the Bestow Be Cleansed. Now this probably needs a little bit of an update. We also have a Gut Love now, which was released last year, and the brand new release this week, which is our Collagen Boost. Now our Collagen Boost has zinc in there as well, and off the top of my head I can't remember the grams of zinc in there. Cassie, if you can remember, can you pop that in the chat for me? But it's got zinc, and zinc is fantastic at treating acne as well. So I think Janine's answer to acne yesterday was the plus oil, and then possibly the collagen boost if they have no gut issues. Other things you want to do with a congested skin: remove perspiration from the skin ASAP. So if your client is an acne client suffering from acne any grades, and they are working out a lot and go to the gym and go to boot camps, whatever it might be, that might be a little bit different than working out at home now, you want to use something to get that perspiration from the skin immediately. So something like your Whatnot wipes. We've got the beauty wipes from Image Skincare as well. So there's lots of things you can carry around in your gym bag just to be able to do that. It's really great for kids' sports bags as well. Using non-comedogenic skincare products and makeup, which we're going to talk about. Hydrating skin products too, lots of water, and extraction facials to help release any blockages. For acne vulgaris, you can see here we not only need to eliminate congesting foods, but heating foods and liver loaders. So what are they? They are your coffee, they are your alcohol, chocolate, peanuts, your spicy foods, and believe it or not, your oranges, strawberries and orange juice will actually cause heating within the skin. So it's really important that we eliminate those for acne vulgaris. Liver loaders would be anything from your processed foods, food additives, your sugars, and your trans fats as well. So we can see here we recommend the Bestow oil, the Be Cleansed, and the Bestow Beauty Powder. We want fermented foods in there, so if they can drink kombucha, that would be really great as well. And vitamin A rich foods, so your carrots is really good to get in there. And you can see here they've got zinc tests for any deficiency. And look at extra supplements if required. Sorry, my dogs are going crazy outside. You can't hear them. But now that we've got the collagen boost, if they do have a zinc deficiency, we can actually get them onto the collagen boost now as well. So if they do have gut issues, you might swap that up depending on what you might get them started on. You might suggest the Bestow oil and the Gut Love, and possibly following our Gut Love cleanse that Janine has in our beautiful Gut Skin Connection book. That's a really good place to start. And lots of kind of rituals as well, like reducing that stress. Sometimes if somebody has acne and has a lot of it, it will stress them out. They're worried about how that looks, what everybody is thinking. So finding ways to de-stress will be really great for that client too. Kind of the same things as before, keeping the hair off the face, removing perspiration, after exercising, anything like that would be good too. So it's actually a really great idea for acne clients to recommend they keep a food diary. So this doesn't have to be a written diary that they carry around. There's a couple of apps you could use to try to log what you're eating. So I think Janine suggested Chronometer, I think it was called the other day, or what I generally use is MyFitnessPal. So the reason I suggest that for your clients is if they have a setback or a flare-up, we can go back through their food diary and see if there was a trigger there for them. If that pops up a lot, it might be, oh, I had strawberries, totally forgot that was a heating food. It's not something that we think it's a fruit, it's good for us, but we don't realize it's actually a heating food as well. So it's a really, really great idea to get your clients, when treating acne or rosacea, to keep a food diary so we can do any tracing back. Cystic acne as well, so we're going to remove heating foods, congesting foods, liver loaders, and all your refined carbs and sugar. Pretty much the same Bestow recommendations here, but it's super important that we treat this with the utmost care. We want to make sure we're healing, we're hydrating that skin. So that's just super important when treating your cystic acne too. Okay, I'll move on if Cassie hasn't jumped in with any questions. We're going to look now at modality options when treating acne. Firstly, Dermalux LED, one of our favorites. So we can utilize our 450 nanometer wavelength, which is blue light. This will have a powerful antibacterial action on the skin. It's going to treat your acne without causing any irritation whatsoever, and it will assist in preventing breakouts and really just generally balance that oil flow. We can also utilize our 830 nanometer wavelength, which is your near infrared. And this light is fantastic at reducing pigmentation. It will assist in scar reduction and prevention, as well as reducing inflammation and redness on the skin. So there are two that you will definitely lean upon if you have LED in your business. And you've got lots of settings and options there that you can do. So let's have a look at some before and afters of Dermalux. So here we have both pictures have used all three lights. So you can definitely use red on an acne skin. If it is quite angry, inflamed, quite red already, I probably would start with blue and near infrared and then introduce your red once we've calmed that inflammation. Because your red, as you know, will get your ATP synthesis working properly, but it is quite a stimulating light, so we just want to make sure that we bring that in at the correct time. Then we've got our EPN. So this is obviously new to PBS, so we can actually treat with our EPN acne grades 1 and 2, congestion and blackheads. So treatment benefits, you're going to be exfoliating and effectively removing dead skin cells and surface oil to prevent those blocked pores. You will regulate sebum production and reduce excessive oil flow, which can subsequently stretch and clog pores. You will get increased cell proliferation and regeneration, so creating that really healthy skin and a faster healing response and repairing as well. Oxygenation increases oxygen flow and is aided by the microchannels in the skin, so we're going to discourage that environment for P. acne to grow. And it increases topical product absorption by up to 200%. So we recommend between 5 and 10 treatments in total, performed every 2 to 4 weeks. So there's a side note here, microneedling should not be performed in any active cysts, pustules or acne grades 3 and 4. So we have to make sure that we're only doing this on acne grades 1 and 2. With our EPN, we can also look at treating scarring. Okay, so we talked about the atrophic scars that we've got, the 3 different subtypes that we have. We want to really try and help reduce that scarring. So we can use our needling to do that. The needling action will actually break down that existing fibrous tissue while increasing that collagen and elastin to create that new cell tissue. Increased cell proliferation and regeneration enables a faster and more effective repair response. So you're actually going to lower the risk of future scarring whilst treating existing scars, which is really good as well. The growth of new blood vessels to increase blood flow and have more effective oxygenation on the skin. So we recommend, again, 5 to 10 treatments in total performed every 2 to 4 weeks, and cumulative results will occur. So I think it's important when you are looking at any type of modalities, it's important to note that you want to make sure that they have these treatments frequently as we can, especially with LED. And that's where you're going to get the cumulative results. You're going to see better results the more often they can have it, but obviously spaced out, especially with EPN in the right time. So we've got a little side note here about keloid and pitted scarring, the hardest to treat and may require more treatment, or forwarding them on to a specialist. Next, I wanted to talk about Linton. So Linton lasers is obviously quite new to professional beauty solutions, but you can actually treat acne with the 585 IPL handpiece, which is on our Exolite, but it's also on the 3Juve. So it's been known for quite some time that acne is a photoresponsive condition, and we know that the shorter wavelengths have shown to destroy P. acne bacteria. So your IPL will deliver wavelengths going to target both bacteria and the sebaceous glands. So when we look at using 585 IPL hand paste, we're typically looking around about 6 treatments, but it's actually best done in conjunction with peels or microdermabrasion and having those treatments spacing every 2 to 3 weeks. So I think the lovely Hayley from Linton Lasers spoke about this on, lost track of my days, I believe that was Monday, about the fact that you can do either or, but it is good to do in combination with both. So here's some really amazing before and after. So the one on the left here is 2 treatments, which is a pretty awesome result on acne, and then 4 sessions on the picture on the right. That's really, really impressive. Make sure if you have any questions about Linton to contact our head office or just reach out to your business development manager. We also have our 3Juve device, which has resurface on there, which is a fractional laser. Okay, so what we can use this for is treating our acne scarring. So what it does, it causes very superficial ablation in the skin. There no melanin absorption with this wavelengths that we use, which means it will resurface, is suitable for all skin types. However, we do need to be aware of the increased risk of post-inflammatory hyperpigmentation on your darker Fitzpatricks, but you can treat them. Resurface also initiates that wound healing response, and as the skin heals itself, the tissue and the collagen stimulation will occur, and that will improve the texture and the scarring of the skin. So how many treatments do we recommend? 4 treatments, 4 weeks apart, with our resurface fractional laser. And here's some before and after. Now, I apologize, I couldn't find exactly how many treatments this was. If anyone would like that information, let us know in the chat and we can get this to you. Oh, sorry, it does say up the top, completely lying. Resurface on the left is 6 treatments. The last one was down the bottom. And on the right-hand side is your 3 treatments. So that is such an amazing result for our scarring. So that's why your before and afters are so important when we're treating acne, so we can document the results we're getting as well. So last but not least, before we finish up today and go through any questions, I wanted to talk about the importance of clinical grade makeup to treat acne. It's so important when you're doing your consultation with your acne clients to ask the question, what are you wearing on your skin for 12+ hours a day? What are you putting on top of this amazing skincare I'm giving you and the amazing treatments that we're doing to reduce our acne? Are you wearing makeup that's just bought from, you know, a chemist or just another shop? Are they wearing clinical grade mineral makeup? If that is not a question you're asking within your clinic, I encourage you to do so. If you allow your clients to walk around for 12+ hours a day wearing a makeup that is not allowing the skin to breathe, clogging the pores, making that acne worse, you're just going to keep hitting roadblocks in regards to their actual results on the skin. So Youngblood's unparalleled quality, it's completely free of fragrance, oils, talcs, parabens and artificial dyes. So that means we're not going to run into any issues if the skin's already sensitive. We're not going to create a more sensitive environment. Oily skin can be quite dull and not have much clarity, so the Youngblood will help to create a healthy natural glow. There is a foundation for all skin types and all skin conditions. It has SPF in there as well, and it's finely milled for that weightless adjustable coverage. So usually when I've worked with acne clients in the past, they'll be wearing a heavy makeup, not mentioning any brand names, but they're wearing a heavy makeup that is just piled on to try and cover up that acne. And it feels heavy, it drags the skin down. But with Youngblood, you can put this on, you can wear it at full coverage and feel completely weightless. It'll feel like a second skin. Water resistant, so it lasts without touch-ups, and it's non-chronogenic, non-acnogenic. That's what we've been saying the whole time. We want to make sure we're eliminating those types of products. So Youngblood is a clinical grade mineral makeup. It's going to allow the skin to breathe and function normally. Non-chronogenic, low risk of allergies and sensitivities, broad spectrum sun protection, as I say, and it's soothing and calming. So that's really important that we definitely assess that in a consultation with our acne clients. Last but not least, I don't think I have a slide for this. I don't, so I'll go back to that one. Last but not least is other tips that I always give my acne clients. Clean your makeup brushes. Okay, so I know a lot of people don't clean their makeup brushes on a regular basis, so it's important that we use shampoo, and you'll probably correct me if I'm wrong in this, no conditioner on the new Young Blood brushes, just shampoo and leave them to dry. So it's important that we do that. Cleaning your mobile phone screen. Okay, so we all sit here with our makeup on answering our calls all day, so clean your mobile phone screen on a regular basis, or if you wear a headset, make sure you clean the little microphone bit that comes down as well. Sunglasses, make sure you clean the little nose, I don't know what they are called, comforters there as well. Avoid leaning and touching our skin, which we kind of should at the moment anyway. Drinking lots of water to assist in hydration of the skin. What else do I usually say? Changing pillowcase as well. So if you are a grade 3 or 4 acne, I'm looking at changing that pillowcase probably on a daily basis. And scarves. I actually asked one of the other educators in our team, I was like, what else do you recommend with this? But it's getting cold. People wear scarves. How often do people actually wash their scarves? Think about that. It sits right under this jawline where there can be a lot of breakouts. So they are things that you want to definitely take into account. And things like hair. So if they've got a fringe that's coming down, we want to maybe look at pushing that back a little bit so that oil from the hair is not coming onto the skin, that we're pulling our hair back so it's not affecting the skin as well. And even tanning. So if they're a younger client or any age, I guess we all want to tan to feel better. It's important that you look at the ingredients in your tanning product as well. So our Sun Escape is all natural. It's got lots of healthy skin ingredients in it. So if they do tan, again, look at what they're using. Make sure they're not using home tanning products that are full of alcohol, drying out all of that healthy skin that's still there. So I think that's probably about it, and I haven't gone over time yet. But Cassie, do we have any other questions I've not covered?
Hey Julie, it's been great, but we do have one question. Can you please explain the systematic combination of LED lights with acne? So how you would sort of get started with an acne treatment program with the LED?
Yeah, definitely. Look, there is full protocols with LED, depending on the severity of the LED and whether we had a lot of heat, inflammation, and redness in the skin. Personally, I would start with blue and near infrared first, so our near infrared can reduce that inflammation. So that might take maybe 2 treatments, and then we can add in our red. So you can have all 3 lights on that skin, as long as the skin's not dramatically inflamed, hot, and red. Red is our most stimulating light with Dermalux. It doesn't necessarily cause heat in the skin, but because it's so stimulating, we want to make sure we just, as I say, always reduce that inflammation first. So yeah, I would start with our blue, our near infrared for possibly 1, 2, maximum I'd say you probably need 3 treatments, and then put your red into that routine as well. Any other ones?
No, that's it. That's wonderful. Thank you.
No, that's okay. If you do think of any further questions, or you're watching the replay of this, don't hesitate to contact myself. I'm always happy to answer questions on my Facebook or my Instagram, or contact your business development manager. They're here to help. Head office are here to help, and we've got our in-house educators as well. So I hope you've enjoyed today. I hope you've got a lot of notes and things from it. And as I say, any questions, just let me know. Beautiful. Cassie, thanks for joining me.
Thanks, Julie. It was awesome. Thank you.
Thanks, everyone.